What's going around? Sponsored by SN Healthcare. Your health is essential.
Good morning at 9:23. In this morning's What's Going Around segment, the FDA approved a new GLP-1 pill for weight loss. Joining us this morning is Dr. Cadensky. He's an endocrinologist with SN Healthcare, here to discuss all the hype around weight loss drugs. Dr. Cadensky, I know everyone's talking about this, so tell us about this new weight loss pill approved by the FDA and how different it is from what's already on the market.
Well, thank you so much for having me. So there's actually two new drugs on the market. This past week, there's a new drug called Fundeo from Eli Lilly, which is an oral GLP-1 agonist that's unique that it could be taken with or without food, unlike the oral Wegovy tablet, which came out earlier this year. It could provide up to 12% weight loss compared to up to 17% with oral Wegovy. They both start around $149 out of pocket, or about $25 with insurance. And they're great options because previously we were limited to injection medications. So these are great for people who are needle averse.
What are the risks, though, associated with taking these drugs, and are the side effects worth it?
Great question. All drugs have the potential for side effects, so you really need to weigh the risks and benefits with your healthcare provider. Common risks are mostly GI, including nausea, diarrhea, constipation, but there is a risk of gallbladder disease, pancreatitis, and dehydration. There is a contraindication for patients who have a personal or family history of a rare type of thyroid cancer called medullary thyroid cancer, but the benefits are numerous. Besides, the weight loss includes cardiovascular, kidney, and liver protection, a role in treating arthritis, and the first medication to treat obstructive sleep apnea. For many patients, these drugs can have a really positive impact on their health.
And so, Dr. Cadensky, let's talk about microdoses. Can patients be put on microdoses of GLP-1 drugs, and what does that accomplish?
That's a great question. While patients can be put on microdoses of GLP-1 drugs, this tries to gain the benefit of the medication while aiming to minimize the risk of side effects, potentially improving adherence and tolerability. This is considered off-label with limited clinical support for this, mostly coming from anecdotal evidence rather than robust clinical trials. And microdosing often uses compounded medications, which are not FDA approved. Their tolerability and efficacy is not clearly established to be the same. And I think with an expanding treatment pool, I recommend exploring the FDA-approved options with your healthcare provider.
And finally, how do GLP-1 drugs interact with other medications?
Well, in general, they slow stomach emptying, which can delay the absorption of other oral medications. So we do not recommend concomitant use as well with other GLP-1 medications or a similar class of diabetic medications called DPP-4 inhibitors, which can increase the risk of pancreatitis. They may interact with certain oral birth control pills, so backup contraception may be needed. And lastly, with Fundeo, the new drug, it should be used in caution with certain antibiotics, antifungals, and antivirals because they can interact with the same enzyme in the liver, potentially affecting levels of the drug in the body.
All right, Dr. Cadensky, thank you so much for joining us and helping us to understand GLP-1s a little bit better. That's it for this segment. Dan and Hazel, back over to you.